Earlier this year, a train derailment in East Palestine, Ohio, spilled toxic chemicals on the ground and into the air. 8 months later, people there are still waiting for answers about the long-term health and environmental consequences. What happened in Ohio isn't uncommon. On average, there's a chemical incident in this country every 2 days. We went to North Carolina for a look at how one city is trying to move forward after a chemical disaster.
So the plant was literally just across the way here?
Yes.
Sabrina Webster was born and raised in this Winston-Salem neighborhood.
Growing up in Piney Grove, you had your grandparents, your aunties, your cousins, your family and friends.
A tight-knit community where she felt safe and secure. But that all changed one night in early 2022.
What was that night like? What do you remember?
I got a call from my daughter, and she said, "Mom, you're going to have to take a detour." She said, "It's a fire on Indiana Avenue." I could smell the smoke as I got closer. And when I had to take a detour, that's when I saw it was the Weaver fertilizer plant. You could see the blaze, and you could see the firemen up on a high ladder, just spraying water down.
The fire at the Winston Weaver fertilizer plant was fueled by what was stored inside. 600 tons of ammonium nitrate, a chemical commonly used in fertilizer that can accelerate fires and even explode at high temperatures.
I was stopped by a policeman, and he told me I couldn't go no further. And I told him, I said, "Well, I need to come home and check on my daughter and check on my pet." He radioed ahead, and I could hear his sergeant telling him, "Tell her to get her items and move out, leave as soon as possible."
At home, Webster grabbed what she could, clothes, family portraits, her dog GB, and fled.
You couldn't even come through there.
Webster then called her cousin, Vonda Thomas, who lives nearby.
I grabbed my pocketbook, my child, my fiance, and got in the car with our pajamas on, and we left.
No one died in Winston-Salem that night, but other communities haven't been so lucky. In 2013, a fertilizer plant explosion leveled the farming community of West in north-central Texas.
At first, we just saw a little bit of smoke. Next thing I know, shrapnel was falling down everywhere, burning all of us, and we just got out and ran.
The blast left 15 people dead, 12 of them first responders, and as many as 200 others injured. Since 2021, there have been 614 accidents in the United States involving chemicals. And between 2016 and 2020, 133 chemical accidents required more than 64,000 people to be evacuated from their homes and at least 85,000 to shelter in place.
Chemical disasters occur about once every other day in the United States. And so this is a massive problem.
Maya Nye is the federal policy director at Coming Clean, a nonprofit group that advocates for greater safety in the chemical industry. She says the Environmental Protection Agency's risk management program regulates facilities that use these dangerous chemicals.
It's really intended to prevent chemical disasters, and it also requires that facilities develop plans for how they're going to respond to an emergency when a disaster occurs, and to look at what is the worst possible case scenario that could happen should, all of the chemicals at our plant release at one time or there's a huge explosion.
Last year, the EPA proposed changes to the program, which covers about 12,000 U.S. locations. While the chemical industry largely supports the current EPA risk management program, they worry that some of the proposed changes go too far. Kimberly Wise-White is head of regulatory affairs at the American Chemistry Council.
So they need to be very targeted on where there are accidents, where those accidents are driving risk, and identifying those areas and really focusing any enhancements in the RMP program in that area.
But Nye says the revisions don't go far enough.
They have around 140 chemicals that are on this list that they implemented back in the 90s, and it hasn't really been updated since.
Currently, the program covers more than 250 substances that the EPA says pose a significant hazard. Not on the list, the ammonium nitrate that was stored at the Winston Weaver plant.
The same substance used in the 1995 Oklahoma City federal building bombing, the deadliest homegrown terror attack in U.S. history. According to a North Carolina regulator's report, the ammonium nitrate at the Weaver plant was improperly stored. Water was allowed to seep into the wooden bins holding the chemical, which could trigger an explosion. The report also revealed a leaky roof might have contributed to an electrical short and potential fire. In a statement to PBS News Weekend, the EPA said preventing chemical releases is a shared responsibility, and the prime responsibility is on the owners and operators handling chemicals. The Winston Weaver Company didn't respond to a request for comment. 5 lawsuits have been filed against Winston Weaver, alleging negligence, saying they failed to follow industry safety protocols. But Nye says any regulatory gaps are putting communities in danger, especially populations that are already vulnerable.
The communities around chemical facilities are predominantly Black, Latino, and low-income communities. And oftentimes, these communities have the least resources to respond to and to be able to recover from disasters after they happen.
This vacant lot is all that's left of the Winston Weaver fertilizer plant, at least all that's visible. Residents of this neighborhood worry what hazardous chemicals may have been left behind in the soil and in the water.
So that's going to tell us about the sedimentation in the water.
Dr. Callie Brown is an assistant professor of pediatrics at Wake Forest University School of Medicine.
In the immediate aftermath of the fire, there were community meetings that were held in that neighborhood. They wanted this to be studied, and they didn't want to be forgotten.
She's leading a 5-year study looking at the long-term health effects from the Weaver plant fire. What sorts of medical events would you expect to see after an incident like this?
In the first year, we're going to be looking at things like emergency department visits, hospitalizations, and there we do think maybe respiratory illnesses. In the longer term, we don't really have any hypotheses for what we're going to find. So we're looking at lots of different types of diagnoses, things like diabetes, high blood pressure, cancer, dementia, a wide variety of things that could be associated with living in this neighborhood around the plant.
Brown's team will look for lingering contamination in soil, water, and air samples in a 2-mile radius of the plant site. It sounds like part of the goal of this is to empower people in the community.
Absolutely. They had very clear questions and things that they wanted us to look at. They're good questions and important questions, and so we're able to use the data and the resources that we have to get that data back to the community.
If it was an explosion, I wouldn't be sitting here with you today. A whole lot of the families in this neighborhood, generations would have been wiped off the face of this earth.
For Sabrina Webster and Vonda Thomas, the chemical fire could have gone much worse. But it's hard for them not to worry about what's in the air they breathe and in the soil in which they once grew vegetables.
I had bell peppers, I would grow onions, just right here in this little patch.
And she hopes her community will be one of the last to live in fear of the next disaster.